Okay, so it's 6 o'clock and we'll call the Tritone meeting to order. Everybody has received a copy of the minutes, is that correct?
Mm-hmm.
Yes,
Anybody make any suggestions about correcting them or want to approve them? I have something to say about the minutes if nobody else does. Anybody have anything to say? All right, so it's just a minor thing. Down in paragraph 5, it says under motion to accept proposed amendments, it says Ray Williams motion to accept the minutes. I think she motioned to accept the amendments, didn't she?
correct.
The minutes had already been approved up above by motion of Diane, and John seconded. We did that in section 2, and down in section 5, there was a motion to accept the amendments that Jim had put forward.
Correct. Yep. I'll fix that typo in there.
Okay, so that should be accept the amendments.
Yep. You are correct.
Everybody agree with that?
Yes,
All right,
Yes.
can we have a motion to accept the minutes as amended just that way?
so moved. Second.
All in favor?
Aye.
Aye. Hi, Diane.
Okay, so we've accepted the minutes. The next order is the business of COVID-19 updates. Jim, do you want to give us a Tritone update situation?
Sure, give me 1 second while I'm ruffling through my papers. So I thought Amy was going to jump on the call, our lead public health nurse, but she might be a few minutes late. I don't have a lot of COVID-19 updates per se. I mean, the nurses are working really hard. You know, they're working with CHP and other organizations, including the Alliance and others, to try to work on flu vaccination. We're working with the CHP van, the mobile unit. They're kind of making its way through Southern Berkshire. As the Southern Berkshire Collaborative is kind of getting our feet under us, it's taken some time to get licensed as a provider so we can purchase our own vaccines. It's just a matter of paperwork. And then once Amy kind of finds some time to actually start working on that, she gets pulled into contact tracing. And we had a couple clusters back in August and a couple months ago. Things have kind of settled down. We're working with multiple organizations right now to see what the kid vaccinations will be working at the schools. Nothing's been finalized yet, but we're working with that, because I think there's a lot of concern coming out of pediatricians' offices that they don't have the staffing capacity to do it through the pediatrician offices. So while we don't have dates and specifics yet related to what the 5 through 12 vaccination clinics will look like, I'm really advocating to kind of do the regional kind of site things, especially in South County, maybe just do like one full day at W.E. Du Bois and then just kind of deal with that. It's just a lot of work going from school to school to school to school, and also putting burden on the school and the staff and the janitors and so on and so forth, and having a controlled system of providing the program. One of the things that came up this morning, because we're meeting with a lot of school districts for the Southern Berkshire Collaborative, which includes Tritone. We met with Beth Regabudo. She's the superintendent of the Southern Berkshire Regional School District. And one of the things that is coming up as a concern, especially with the kids, potential side effects of the shots. Each one of us has gone through different things, whether it was the Pfizer, the J&J, and the Moderna. And what would that look like for the kids to get their first dose in the middle of a week? And next thing you know, you have a ton of kids being out of school. And I personally got the Moderna, and I got knocked out pretty bad on my second shot. I know people have gotten the Pfizer third, the booster for the third shot, and they've had some challenging issues too. So it's something that I'm really advocating to the leadership on, if and when we do these clinics, we should be strategic on the type of day, if at all possible. So that's going on. We're doing the weekly dashboard. That's being sent out to a lot of organizations to kind of show different things. The nurses have been assisting a lot of the schools with pool testing with some of the school nursing. the rates have kind of settled down a little bit, and I'm going to jump into some of the data here in a few minutes as we revisit the directive. But as of this week, the positivity rate in Lee is 1.6, Lennox 1.5, Stockbridge 1.2, relatively low. Things have settled down just a little bit, and I will pull up, bear with me, and no, that's not what I want to do. Trying to do a screen share. I should be good at this by now. 1 second. So this is what Amy had sent me. And Zach, if you see Amy trying to jump into the waiting room, just let me know, because when I do a screen share, I can't see anything. But this is what she kind of sent to us, kind of comparing the last couple months. August 36, 21, 20. Things have settled out a little bit. Nothing extraordinarily crazy. We've had some small clusters, but nothing. It is what it is, right? I mean, we don't think COVID's going away anytime soon. Hopefully, as the cold weather starts to work its way in, we can be on a fast track to get these kids vaccinated and really promote the boosters before it gets really, really cold. And so we're hoping that all works itself out. Outside of that, before we get into the directive, I mean, Zach, do you have anything crazy related to COVID other than, we still get a couple calls here and there?
Yeah, nothing major, just a few calls here and there. A lot of people just asking, is the directive still active, and just making sure that they're on top. A lot of people just looking for updates, that's about it.
Yeah, the DESE just announced that they extended the mask mandate for the schools through beginning of next year. I'm not really sure exactly when, but it's through the end of the calendar
January
year.
15th.
Okay.
To January 15th it was.
Yeah, it's just, we're still working at things. The inquiries we do get, it's really schools asking about sports, any guidance you want to offer us for indoor basketball leagues, things like that. But we try to keep up on the updates, but right now it's really working, trying to sort out what the school age kids vaccination plan is going to be. And there's still a few things that need to be sorted out. But outside of that,
Anybody have
status
any
quo.
questions about that or anything to add to that?
Yeah, what are the updates for the school sports? I mean, what are you telling them?
Well, they're allowed because we're not in a state of emergency anymore. In the state, they put out best practices and it's allowed. And so when it's a question related to the Tritone towns with respect to the current directive, the directive doesn't prevent sports from happening, but the masking indoors, if you can't social distancing, kind of comes into play.
For the spectators.
For the spectators. Some schools we see people wearing masks, but again, it's not a requirement. So we haven't seen any mass spread with sports yet, although most of the fall sports have been outdoors, cross country, football, soccer. And so as we start to transition into the winter with indoor basketball, the best we can offer is people need to be safe. People should be vaccinated. You should wear a mask where you can't social distance, and
They're not going to check for proof of vaccination for spectators though, right?
I don't think so. Unless it's a school policy, John, because I know, well, hold on, Zach, can you let Ray in? I don't think she's trying to get in. I'm not really sure. Yeah, she's not. Hold on 1 second, John. Unless the school has a requirement, like I know some of the schools have required pool testing if they're doing sports, but I think it may vary across the county, but there's no mandate on showing proof of vaccinations to that degree. At least for the
With
schools.
respect to the side effects of the vaccines in kids, I heard Amy mentioned that she was trying to put together some kind of pediatric panel for, I thought to that end, in some ways. Can you, do you know anything about that, what she was planning to do? You don't?
Yeah, I don't know.
Okay, so, all right, any other questions about that? Well, shall we move on to the discussing the current, what we have in place in terms of a directive and how we'd like to deal with that going forward?
Yeah, and I can give an update. So just for those that may have not been following the progression of the Tritone Directive, it was initially enacted on September 2nd. We made some amendments on the 22nd of September, and the Tritone boards made a commitment to meet on a monthly basis. When we first rolled it out, it was, there's a lot of large scale events that were upcoming, and I think the community responded well to the directive. Most of the large scale events were voluntarily canceled because, as the board knows, the directive was a strong word directive, but it wasn't a mandate with enforcement mechanisms. And so I think, the leadership of the three towns really took that serious. The chambers took that serious. The majority of the large events were canceled. We got, at the time, and Zach can back me up on this, I think we got really good compliance with the restaurants. And while we didn't have the capacity to across the board inspect all these places, the visuals that we saw on Main Street, downtown Stockbridge, Lenox, a lot of people had the signs up. There was a lot of masking going on. We got not a lot of pushback, but a lot of it was more clarification issues, because we didn't put a number on the events that we recommended that to be canceled, which we amended on the 22nd, that we used 5,000. And I think some people misunderstood the directive and misread it as, oh, I got to cancel my wedding, I got to cancel my bar mitzvah. And so we kind of came back on the 22nd of September, we made those amendments. I don't think we get a lot of calls now, Zach. You're in the office more than I am. It's been really kind of quiet, but one of the things that I do see, and while it's hard to measure, I just think as we move further away from the enactment of the directive, we're seeing less masking and less people kind of doing what they need to do. And, and we had a little bit of a spike, in August with some clusters, but it's really settled down. I don't think COVID's going away. And it's just a matter of, do we keep the directive as is? Do we want to consider downgrading it to advisory only? Because it's one of those things where we keep meeting every month and the numbers aren't really changing. They'll go up a little bit, they'll come down a little bit. They'll go up a little bit, they'll come down a little bit. And hopefully it's a pattern that slowly diminishes over time. And it's just really, I don't know how effective this directive will be as we further along. And we also don't have the capacity to respond to every single complaint and require people to do things that the directive all in itself is not a mandate. And so, it's really up to the board what they want to do. It doesn't affect us either way as a department. We don't get a lot of complaints, but I do feel like as we get further away since September, so we're 2 months into this directive now, I think the effectiveness is slowly diminishing.
Jim, what, I don't know, what's the situation in Pittsfield? They don't have a directive for indoor masking for restaurants, do they?
No.
No. So, I just wonder, because our businesses may be hurt a little bit because Pittsfield doesn't have it, we ought to consider downgrading it.
Jim, can I ask a question?
Sure, Julia.
Do you know the percentage of, like you gave our percentage of COVID compared to towns that don't have like a mandate or a directive? Like, are their percentages much higher? because you don't have to go into stores and restaurants in Pittsfield, or I'm not sure what other towns, Adams or wherever. Do you know the rates that there other towns are that don't have mask mandates or directives?
Yeah, great question. So while I don't have that data sitting in front of me, I can tell you from my meeting with the public health nurses today, North Pittsfield numbers are high, in North County numbers are high. They're pretty high. Now, it's hard to associate the directive with the rates, right? Because there's so many factors that go into this. You know, Pittsfield is more of an urban community. The population's a lot higher. It's the central hub of the Berkshires. But while the South County numbers are settling down, the rates are still pretty high in central north.
And yet they don't do a directive.
Yeah, I mean, I can't speak for other towns. It's, yeah.
Can you please explain the communication with private venues for private parties and what the managers of those venues understand to be the rule here? Because venues are canceling events and telling people they have to be masked on dance floors, need to be 6 feet apart from each other if indoors, and telling people they have to move their party to outdoor tents and can't have it indoors. And I am not, it didn't seem that that was what you intended, but that is what is happening at venues and weddings and rehearsal dinners being canceled on people.
Yeah, and we so rolling this out, we sent it out to a lot of different organizations. So like we have permit holders that are licensed through the boards of health, which are many businesses. We sent it through the chambers. We worked with the Eagle, and we sent it to a lot of different organizations. And we keep that communication open. And I think the first iteration of the directive, we were getting similar calls like that, and it kind of dawned on us like, hey, that's not what our intent was. Our intent was, you know, we shouldn't be doing large scale events. And when we meant by large scale, the intent of the board's thought process at the beginning of September is we were looking at things like Apple Squeeze, the Berkshire Botanical thing, the Josh, really large scale events. We weren't even really focusing on the small private things. And I think some places misinterpreted, and just people read what they want to read that may not necessarily be accurate in the directive in itself. And we contacted quite a bit of places, even places that did weddings, not all obviously, because I don't know all of them. And we were really recommending that, hey, try to social distance, keep the parties low. But yeah, I mean, unfortunately, when we did this directive, which is not enforceable, by the way, and people I think are looking at this directive that it's a mandate, and it's really not. It's a really strongly worded directive. And if you look at it, there's no enforcement component to it, and we kind of leave it upon the facility to manage that. It is an unintended consequence of what we did.
But why wouldn't you? You have ruined weddings. And why wouldn't you? And I have called many times, and other people have called. And all I asked was for you to call the venues to make it clear to them that they don't have to cancel. It is just a directive, and it's not what you meant. Yet these events were canceled, and the communication has not gone back. And to make guests wear masks and brides wear masks is just not very empathetic with these people who have already had weddings delayed and delayed and delayed because of COVID, and to be the only town, and you just the luck of the draw to have your venue in this town and then have it canceled again or ruined, and all the pictures ruined because everyone's wearing masks. I think you should go back to all these venues who are not understanding what you meant, because it's very sad of what's happening.
Yeah, and COVID all in itself was sad.
But this is that, of course, COVID's sad, but this is something different, because this is not what you meant. But all these venue owners think that they're going to get in trouble if they allow these weddings to go on. So they cancel and say, because the town has a directive, we can't have it. And that is not the facts. And that's not what you intended. And that should be made clear, because it is ruining happy events that people waited a long time for.
Well, Jim shouldn't be, I'd like to weigh in this. Jim shouldn't be taking all the heat on this. In fact, I think probably I've had the most statements to make about the masking. You know, I've written letters about it and I've said things, and I very much appreciate your frustration about this. You know, it's one of the things, I'm a doctor, one of the things that doctors learn through their careers. In fact, our job every day is to hear people's complaints. That's what we do. You know, people don't realize, but we get complaints. And when people, you know, give us the complaints, it makes us think. And I totally understand your frustration, because I feel the same kind of frustration. Now, I think that you should understand that Jim has been doing, he's been working so hard. And the reason he works so hard is because this disease is a serious disease. Now, for example, last year, I think it was, or maybe 2 years ago, there was a crash on Route 7 in Lenox. Somebody was killed. There was a great deal of uproar about that. There were pictures in the paper. There were letters to the editor. There were different things written about it. And eventually a whole lot of stuff was done about it. And Berkshire County has, on average, every year, about 10 people that die from motor vehicle accidents, about 10 people. And Berkshire County is actually one of the highest counties in the Commonwealth in terms of motor vehicle mortalities. We have 10 people die every year. It's a very important issue. Now, in the last 4 weeks, 10 people have died in the Berkshires from coronavirus. 10. Just as many people as die all year long from motor vehicle accidents. The difference here is that there is, and I think this is one of the things that leads to frustration in everybody's part, is there's no real awareness of how serious this disease is unless you know somebody who died, or you're right on the front lines in the healthcare business where you see these people coming in, or you're in places where you see, where you know that the hospitals are overwhelmed because this thing surges out of control and the resources are overwhelmed. So it's certainly important for people to have a significant experience during their weddings. It's important for them to have a good feeling from it, and we don't want to take that away. But when you say that people are worried about potentially breaking a regulation or doing something like that, that's not the real focus here. The people should be worried about transmitting the disease to somebody else, who later transmits the disease to somebody else who dies. And this is the kind of thing that happens here, and we don't know it. So yes, you absolutely have every right to be frustrated. I think that our wording could have been better. Looking back on it retrospectively, we didn't have the ability to do everything that we wanted to. And I think Jim is right now bringing up the fact that things have changed. There were huge outdoor and indoor events planned, and they were modified because we did take a significant stand. And I think it was a very good stand that we took, but it wasn't perfect. We could have somehow come up with some better English language and maybe responded to some questions a little bit better that some people had, or given people more of an understanding about how to do their weddings. But in the long run, I think we saved lives. We can't show that, but I'm positive that we did. The numbers came down right after our directive. We've had people complying with it all along. And I think now, because of that, we're in a position to be a little more relaxed about it, because we don't want to put people in boxes and put them in the woods so they don't die from coronavirus. We want people to be happy and do things, but we're trying to do the best we can to take into account the fact that people die from this disease, and most people don't know it.
By the way, so I everything you said, fine. We can't go back in time and ruin the wedding, go back and have these weddings the right way over the last 2 months, where we could only go forward. And all I asked a month ago, and it was never made clear to my venue, and now I'm asking again, then put the words in your directive, making it clearer that this is not for private parties. Go to those venues and explain to them they don't have to cancel this. They don't have to make brides wear masks. They don't have, and just, it's about communication. It has nothing to do with this horrible disease. Also, what other places did was require negative COVID tests. People are willing to do that for weddings. To be told you can't have it because of a directive that is misunderstood by these venues is just about communication. I'm not arguing COVID. I'm asking you to communicate clearly to people, and that is not what has been done, and it's not too late. It's too late for mine, and I am only here because of caring about the future brides. Okay?
You made a very good point. You made a very good point, and I think we should do something about that very point. So let us see what we can do. Stay with us and see if we haven't improved the situation by the time we're done.
Jim, I have a
appreciate that.
question.
Dr. Westpeiser, go ahead.
Have you heard from other venues or hosts of events about misunderstanding? I just went over the directive again from September, and it's pretty clear that it's a directive. It doesn't say anywhere that it's optional, but I don't know that that's our goal, to make it sound more lenient. But have you heard from any other events? Because if there's like a groundswell, we could potentially, get something out.
Can
But
I
I wanted
suggest
to know
something?
from you,
So,
I'm still, hold
Yeah.
on a second. Jim,
yes, go ahead.
has there been other misunderstandings?
So I personally received one phone call from Venford Hall when it first went active, and we worked with Venford Hall. I spoke to the executive director. Now I know Zach probably got the grunt of those phone calls, and I'll let him kind of give you a feel, but I don't feel there was a groundswell on this. It doesn't mean there hasn't, but we just haven't received that. And before Zach jumps in, I just want to explain to the board that, like, we respond to the community. Every complaint and every inquiry that comes in to our office, we respond. And so I want to say, like, I don't know exactly what the ask was, but I'll talk to Zach and he can talk about that. But like, we try our best to clarify the directive. And this is the board's decision that they instructed our department to initiate. And we follow through on that directive. And I don't have unilateral authority to make significant shifts in that directive unless the board authorizes that to happen. And hopefully through this process tonight, sort of like making sausage, hopefully we come out with a resolution that we can clarify a lot of this. So go ahead, Zach.
All right, yeah, so anytime the board passes any directive or anything related to COVID, I do an email blast. I send out about 400 or 500 emails to every permit holder. And then I usually spend the next 2 days fielding calls from any permit holder that has questions. I can't speak to a lot of specific examples, but anecdotally, I had a number of venues call up. They ask for clarifications, anything they have. I know I spoke with Ventford Hall, the Mount, Tanglewood, restaurants called, childcare places call. I spend a lot of my time just communicating and explaining to permit holders. So if there's somebody we missed, it happens. But I can say that everyone's questions that get answered or that call get answered. And I explain the directive frequently, just the way Jim stated it earlier, that this isn't, once we realize that people were misinterpreting it, the answers to the calls changed, that no, this is directed at larger events. We put in the more than 5,000 people language, and that made it a lot easier. And once we did that, the calls really dropped off after that last meeting we had.
That message did not get through to venues who said that everyone had to wear masks, except when they were sitting and eating. And to
Hold it a second. I'd just like to try to get this underway. We're going to go through looking at this. Thank you very much for your input, LM. I don't know who you are, but I'd like you to try to let us go on with the meeting here. without any further interruption, unless you get my attention and I'll call on you if you don't mind. But we will pay attention to what you said. I'm sure that whatever happened to you has probably also happened to some other people. I'm sure that that's the case. But nevertheless, wait till you see what we've accomplished tonight and see where we go.
Diane?
It may not be pertinent to it, but when Zach mentioned that he sends out email blasts to everybody that he knows about, what are the chances of just asking people if they're interested in keeping abreast with what might come out in an email blast, that you could add them to your list? I mean, you may not know all the venues that are out there at all,
don't.
because people, startup companies or whatever, but maybe they could, at some point, whoever calls you and says they have a concern, could you ask them possibly, would you like to be on our email blast list? To stay abreast?
I bet we could put a sign up on our website. I bet we could find a way to do that.
It might help.
Definitely.
Well, we try our best.
You do.
We have a lot of permit holders. We work through the chambers. We work through all 3 town halls. We work with a lot of organizations. Do we capture all of them? Absolutely not. That's why, the Eagle, and Clarence covers a lot of what we do. It also gets an Eagle. We put things on the Facebook page, and it's not a perfect system at all. And I think the board needs to continue to engage this conversation so we can come with some type of decision on whether we want to keep the directive as is, keep retooling it, or do we want to just downgrade this thing to an advisory to just meet what the CDC recommendations are and just move on.
What does the advisory consist of, Jim? What would, in reality, how would that work? Or, what
Well,
would
I mean, we would, it's really just people should mask, if you feel uncomfortable. I mean, there's CDC best practices out there. And one of the things I thought of, is if we work an advisory, I just pull what CDC has, that people with underlying health conditions, that even if you're vaccinated, if you feel uncomfortable, you should mask. People should still continue to social mask and social distance where applicable, but it's really advisory. It's not shall and you should and this, that, whatever. And maybe just remind people about the holiday season upcoming, about travel.
Would the businesses have to have a sign on their door still?
Well, an advisory would take that away. I mean, we can encourage it, but we don't want to say you shall. We encourage businesses to post signs that kind of match up with the CDC guidances.
Because I think since we're going down in numbers, I think that's something that we ought to consider, to go to an advisory. That's my opinion.
And I'll be honest with you, we've put so much energy in the last 2 years, and for those that aren't familiar with Tritone, we never closed. We were the one department that never shut down. We worked 24 hours a day, 7 days a week, we're on call. And so we've been working tirelessly, really pushing a lot of good information out there. But we still see a lot of people masking. The responsible people that get it are masking.
Right.
People are getting vaccinated. We're still incrementally increasing vaccination rates. But there are people out there that, after all this energy and resources and outreach, and no matter what we say or what we do, they're going to refuse to wear a mask, and they're not going to get vaccinated. We are not going, whether you have a mandate, a directive, an advisory, or anything, we are not going to change people's minds that just refuse and flat out not wear a mask. I mean, I go shopping in Price Chopper and Lenox on the way home.
I do too.
At least when I'm there, a large percent of customers are masked. All the employees are masked, whether that's directive or not. And hopefully, if the board decides to downgrade this, the responsible people will continue to do the right thing until this thing's really over with. But it's not going anywhere.
No.
Continue to be responsible.
I have some of the numbers for the last week. I don't know, did Amy send these around to everybody? Does everybody know what the numbers are? There's, for example, Berkshire County currently has a a case rate of 163 per 100,000, which is a CDC high transmission rate case rate. The week before, Berkshire County had 146, which was about 20, almost 17 less. So that it was still high, but it wasn't as high as it is now. So Berkshire County has been rising in the last week. Now, if you look at the country nationally, it seems like the last wave has abated and is sort of flattening off a little bit. If you look at last year in October, when people started to go indoors, the thing took off. I mean, that was the huge wave that we had. So we're dealing with a lot of uncertainties, a lot of different ideas, besides the fact that people are getting vaccinated with boosters now. There'll be boosters for the kids. We have a lot of different things going in different directions. And so that I think everybody has a right to a certain kind of an opinion about different things in this situation. I would recommend that looking at all these things and considering what kinds of enforceability capability we have, and the fact that we've achieved what we needed to with these big events, that we would consider taking the same thing that we had in our directive, exactly the same things, and change the wording to be advised. That we advise people to do this. And the reason we should advise them to do it is because the disease is still here and it's never going away. And what I think we need to start to think about as a group of medical boards is, how are we going to deal with this chronically? What is our approach going to be to this coronavirus every year from now on? Because this is what's going to happen to it. It may not be as seasonal as the flu was, but it's just going to keep coming back and coming back. At least that's my opinion about it. It's not going away. And we ought to have figured out what our plan is so that we don't have to rethink it each time we get another wave. We should just be able to do what we're doing, automatically. That's my suggestion. So I first of all, I think that we're in a stage where we can take the directive we had and just move the wording down a level. Just advise people, because it's still here, to do the same thing that we already, we're really adamantly recommending to them, and directing them to do that for their safety. But we can do it in a less, in a way that isn't as ambiguous in terms of that we're going to do something to enforce it. We're not. I don't think we have the capability to. I don't think at this stage I wouldn't recommend enforcing anything about this, but I think we still have to recommend to people and advise them that they be safe with this, because it is still a bad disease.
I would certainly agree with that. I don't think that one wants to step away from this entirely. You need to give cover to people who might otherwise be swayed by what they see, that is, maskless people. If they see more people masked, it becomes more the thing to do. And I think it is important, and it's important particularly because we are getting into the season, which is going to be flu and cold season as well. Masks are good for preventing that. And I think I agree with you. It has to come down a little bit, but I wouldn't make the difference quite so obvious as to simply remove the advisory. I think it needs to stay.
In the directive or the advisory?
I think at this point, it probably, since in truth, we don't have any way to enforce it.
Right.
I recently visited in Cleveland, and you'll be happy to know that everybody who enters the Rock and Roll Hall of Fame is masked. Everyone we went out to dinner in the restaurants were masked. In Pittsfield, we went to a movie yesterday afternoon, and there were 6 people in the movie theater. They were all of roughly comparable age, and all of them were masked in spite of the absence of a mandate.
Mm-hmm.
We need to continue to think in terms of masking, particularly for indoor activities. Outdoor, that's not so much a problem.
But
And
do you agree with the advisory, going from a directive to an advisory?
I think that it's a reasonable step to take at this point,
Mhm.
but I wouldn't walk away from the notion of continuing to vigorously support people
Absolutely.
who will mask.
Absolutely. I'm just wondering about the signs on the doors and that kind of thing. Jim said with an advisory, they don't have to have signs. Will people mask if they don't see a sign?
I think that one of the ways of approaching that is to try to get the stores, the theaters, the venues to say, you know, we've put up with this for now these 18, 20 months. We've never really done it right to begin with. But it would be a good thing to do for your community.
Mhm.
Well, and to add-
Stand up for and support your community in this. Remind people that masking is the way to go.
And Dr. Blagg, a lot of the restaurants have been pushing the masking anyway, because they already don't have enough staff to function the normal operating hours. And even with vaccination and breakthrough cases, you still have to be polled to do contact tracing and go into ice, you know what I mean, and be not asymptomatic before they go in. So restaurants are really stepping up because they can only handle, they barely have enough staff now. And so they're actually doing a really good job, like almost voluntarily, even through the directive, that they're still requiring people with masks. And I hope that
Yes.
continues.
Let someone with a staff of 10 lose two of their servers to COVID. Their productivity will go down.
Any other inputs on this? Anybody else want to say anything?
Yes, I would like to speak.
Bob?
I think the original intent of a strongly worded recommendation and policy or statement, all the reasons for that stand. And if an occasional entity is not getting the meaning of a directive, despite the fact that it sounds like a lot of vendors and institutions have called and asked for clarification. If some have not called, they certainly could call. As a tangent, they should call. And any customer can direct where their money's going toward the vendor as a customer to have them call. But one way to improve, potentially clarify, but not soften, not now, is to define what a directive is a little better in any sort of new outgoing information. And that could be done by explaining it in, brackets, parentheses, or as a footnote, and clearly state this is this is not enforceable. It does not carry with it a penalty of, some sort of regulatory penalty or fine, but it is based on our recommendation as a Board of Health. I'm interested and want people to be able to connect and be socially. I want them to use our vendors. I want businesses to be successful and not go out of business. I want employees to remain on the job and not get sick or have a few days of structural unemployment because they're waiting for a test or a family test, etc. But all those, for me and my role on the Board of Health, are secondary. My primary goal as a member of this body is to weigh everything, come up with the appropriate statement language. And I think we did that. And I think if it's been misunderstood, then we can clarify the meaning of the term directive. But to soften it, to take signs off of windows, masking in 95%, I don't know, some huge percentage of their applicability. Masking is simple and straightforward and easy and painless. Sure, it might interfere with some of the social characteristics of certain things, but the vast majority of restaurants are allowing masks off. I mean, they have to when you're eating, etc. But masks on your way in and when you're mobile, masks in the store, unless you're mandating vaccination, 6 feet and a mask is still easy, relatively painless and appropriate. If we've erred, it might be to have not defined the term directive more effectively. But that would be my piece of recommendation. And I just don't feel like it's time to back off the gas.
Thank you, Bob. Bob, I think Bob pointed out to me how I might have been misunderstood when I was talking about softening things. And thank you, Bob, for that. I really meant, although I wasn't I didn't state it clearly like Bob did. I wanted to make it clear to people that this isn't a regulation. This is not an order. This is not something that they're going to be thrown in jail for, or that they're going to have some sort of fine for. Their business will be closed down for if they don't follow it. But insofar as all of the specific recommendations that we put into it that were really well thought out, I think, about masking, social distancing, all of that should be absolutely in place as an extremely strong recommendation to people, given the fact that we can't do something that would be more enforceable at the time. So to soften it, I mean exactly what Bob is saying. I agree with him completely. And I don't mean to soften what people do at all. They need to take the same precautions. It's just that it should be clarified so that people know that we're not ordering something and then falling down in its enforcement.
Yeah, and I think the events language is one of the sticklers that we need to look at. But I think promoting masking, recommend signage on doors, social distancing, and symptomatic stay at home, get tested if you travel, I think are all still legitimate things we can strongly recommend, but as an advisory level. Just I mean, we can retool it because there's a lot of shalls in there that we can talk about, recommend and whatnot. But yeah, it's whatever the board wants, and we'll make it happen and do our best to get it out to the community.
Well, we did clarify things at the last meeting. I think that was a big improvement. That made it clearer for people after our first shot at it. Does anybody else have something significantly different from what's been said to say at this point?
Is it all right if I say something? I'm not on the board.
Please say something.
I'll ask something. What are other towns in Massachusetts and neighboring states doing?
All over the place.
Well, there's a lot of municipalities in Massachusetts that have been very aggressive with regulatory thing. Amherst is mandating vaccinations. There's a lot of municipalities in Massachusetts that have implemented actual mandates with enforcement capabilities. Businesses, institutions, colleges are mandating things. Berkshire County, it's kind of all over the place. And that's what happens when the state takes away the uniformity from the state, and it ends up being left by municipality. And but it's kind of all over the place. Other states are doing different things too, and it's just a matter of trying to be consistent so people understand. I don't want people canceling weddings. I don't want people ruining their wedding photos. And maybe we can put some language in there that any scale venue, people we would promote that people be vaccinated, and we can't require it or mandate it, and we can't enforce that, but we can put some making recommendations. If you're going to do this, this is what you should be thinking about.
One thing, what the other places are doing really isn't that relevant. What we're looking at here is Berkshire County has a high case rate county. Berkshire County, if you look at the rest of the state, I was just looking at the Johns Hopkins site and looking at some of the numbers there. When you compare Berkshire County to some of the other counties, I just was doing the math pretty quickly there. It looks like Berkshire County has a pretty high rate compared to other counties. And what we're dealing with here is we don't have the ability to make a mandate based on Berkshire County per se, but we certainly interact with Berkshire County. We understand that it's foliage season. Lenox and the towns were packed with people in the last couple of weekends. And, we have to be thinking locally, we're not going to, I don't think, I wouldn't recommend that we do things just based on what some other towns are doing. I think we have to look at what's going on here. And I think we've taken a good path. And I'd like to see us stay with the path that we've taken based on what's happening here. What's happening here is what counts. That's how we make our decisions, not what's happening, let's say, in Northampton.
So is there a consensus that, obviously, is there other board members that want to chime in? So I can try to inventory like what we're looking at here. Is everyone kind of good? So is the consensus sort of keeping the directive, but really cleaning up the language to be more of a recommendation, but try to keep the spirit of the directive alive, but try to take out, it is a long directive, maybe shorten it up, but just have some really strong points about encouraging, the signage, masking, social distancing. And, if you attend any event, you should be thinking about social distancing and masking where applicable, but really get away from the language of a shall. Is that what we're thinking?
Well, based on what your definition of I can't remember not the direct, but what's the other one we're talking? I'm having a senior moment here.
The advisory?
Advisory, yeah. I based on that definition, that would be my vote. It might be against everyone else, but that's what I think.
And also too is the board reserves the right and authority to go back and revisit any advisory, any directive that will reflect any public health issues that come back. We don't want to be on this cyclical thing every other month because it confuses the community. But, if something, we downgrade this to an advisory, but still have the spirit of the directive, but more clarity for the community.
Mm-hmm.
Something.
There are a few people that haven't said anything about this and usually have very good opinions. I'm wondering if anybody wants to speak up that hasn't spoken yet, just to get see where we are. Does anybody else on the board want to say some things? Joanne, I haven't heard you say anything.
I think words are important. And like I said last time, if you go to we advise, that was where we went with when we changed it to the stronger language, because that is not going to get people to do what you think you want them to do if you just advise, So I think keeping the directive, knowing that you can't enforce it, is probably a smarter way to go than to go to an advisory.
I think keeping the directive is a good idea. I just think we need better definition for everybody about it.
Diane, do you have anything to say?
No, I agree with Bob Westphizer entirely. I think we just need a little more clarification and maybe tidying up what we left to be kind of on the fringes for everybody to understand.
Carissa, did you say anything about this yet?
You're on mute, Carissa.
You're muted, Clarissa.
Okay, there we go. I don't have the directive in front of me. I'm sure it's there somewhere, but I guess it might be nice if it was easy in the language to see if you have any questions on how this advisory or directive is going to affect your upcoming event, please contact the Tri-Town Board of Health at such and such, your phone number or email address or whatever, just so that you're easy to reach I'm sure your stuff is right there on the directive, but just so that it's right there,
Yeah.
and easy to access. And, I don't know, that would be my 2 cents.
Yeah, I mean, I think the biggest controversy was the events and then masking indoors. So we clarified over 5,000
Right,
outdoor events. We're asking people to seriously reconsider postponing and canceling. And anything less than 5,000 to use mitigation strategies such as contact tracing, masking where applicable, and social distancing. But I think, a couple of people that spoke tonight are concerned that it affects their private wedding, requiring masking with photos.
Right.
And it just, I can clean up some of the shalls in there and keep the
Mhm.
spirit of the directive. Do we want to try to clarify recommendations that,
You just tighten it up just a little. I'm just hearing some concerns about events and just maybe just for ease of contact information. I don't know.
yeah, and I think it's hard to just, if we want to keep the directive and clean up some of the shall language, it really comes to the small scale events. So we need to decide, are we going to continue to promote masking at indoor events, at weddings, and social distancing? Or do we say, as part of some mitigation strategies, you may want to consider negative COVID tests, vaccinations, even though we can't enforce it? Because I think the restaurants and the signage in the restaurants and the businesses aren't really the controversial piece. What I'm hearing, if we get anything out of it, it's the small events, the brides are upset,
Right.
people are canceling venues. So we have to really retool the event language, if
Right.
anything at all. And I don't know if
Is
we're
that
going to
a-
accomplish that tonight.
No, I don't think that's another conversation.
I need some direction from the board if you want me to retool this, how I'm gonna do this to make it easier for some of these wedding and bar mitzvah events so they don't have to mask.
Right.
As far as
So there were, okay, let's see if people agree with me about how this is settling out here a little bit. Seem to me to be 3 different issues here. One of them is this small event handling, which that's one issue. The second issue is the spirit of the directive. And the third of it is the linguistics, how to avoid ambiguity, misunderstanding, and things like that. Does anybody see any other issues in it besides those three issues? In other words, one is dealing with the spirit of it. Do we want to downgrade the spirit of it or not? The second thing is the linguistic, clarifying things so there's not misunderstandings in general about what the boards are going to do if there's a violation, and that degree of misunderstanding of what we're trying to accomplish through language. And then lastly, there's a small venue technical kind of idea that we have to look at. Does anybody see any other issues in that? In the first place, does that make sense to everybody, what I just said? Does that seem to be parsing the ideas out in a way that we might be able to handle them?
I just like to make one statement about a restaurant issue. One of the restaurants that I go to frequently, I mean, for a person to wear, person that goes in to eat in a restaurant, they wear the mask in, they take it off at the table, they wear a mask out. That's nothing. That's not a burden at all, right? But for the staff that works there all day long, or for cooking in the back kitchen, to wear the mask the whole time, they told me it's a burden. It's tough. So I'm not taking away the spirit in any way, shape, or form. I think people that go into a restaurant should wear it, take it off of the table, and go off. But for the staff, it's tough. So that was my idea about maybe softening it a little bit, not taking the spirit away from it necessarily, not changing what people do going in and out. But for the staff to have to wear a mask while they're cooking or waiting on customers 8 hours a day, that might be kind of tough.
So in addition to fine tuning, let's say the small venue idea. We'd also be interested in the idea of fine tuning a couple of different kinds of ideas, like what you're just talking about, and looking at specific cases to see if we might weigh in that also. So can I just ask for a show of hands here? Does anybody want to downgrade the spirit of the directive? In other words, the idea that we were putting first our job to protect the public health, and that we saw that there was a threat to the public health, and we wanted to make it clear to the public that this was a threat, and in our exposition, explain to them what they needed to do to diminish the threat. Now, does anybody want to downgrade that idea in any way, or diminish the spirit of it, or soften it, or do anything like that?
I don't want to downgrade it, but I like Jim's definition of the advisory. I would go with that.
My understanding of the CDC guidelines do suggest that people can participate in events similar to those that they did before the pandemic, but only if they're all fully vaccinated. So with regard to small venues, in order to satisfy just what I know, and maybe I'm wrong about some of this stuff, but my reading of recommendations by experts way more experienced than me is that we would have, regarding small venues, we would have to then get into language about somehow mandating and or strongly encouraging or directing 100% vaccination and proving that event. In order to relax mask and 6 feet in that setting. So I don't know if I think that's doable, but it will require another meeting. It will require gathering some information and looking at the CDC and the mass.gov guidance and thinking about it in the context of our local factors. So I'm open to that, but I wouldn't downgrade the language without, to that CDC relaxation, knowing that the CDC recommendation is only in the setting of 100% vaccination. So that becomes difficult, and each event then may require special counseling. Depending on how many, or boy, this person's flying in and we don't know if they're going to, and then what do you do when they forget their vaccine card, or are you even going to use vaccine cards? I mean, there's a lot of logistical complexity to that that would require hashing out. And I am willing to do that, but I think that's a process that would require more input than I'm willing to go through tonight.
And Bob, I can easily change the directive without violating the spirit to say small venues, you must mask indoors and socially distance, unless the following recommendations are put in place. But again, it's recommendations, and we can't enforce that. It puts the burden back on them. So like, you get venues that are complaining that they don't want to wear a mask, that ruins photos, but then the venue's going to have to step up and do more administrative things to make that event happen. So no matter what, we're still kind of back at the same place. And I don't know, we're about an hour and 5 minutes into this conversation, and I don't know if I have enough direction yet, because we're kind of like all over the place to make significant changes that meets the needs of the board. So we may have to keep this directive where it is and then regroup as a board, because I don't, usually I'm pretty good at getting the feel from the board and then taking what the board's looking for and putting into a directive. Right now, I'm kind of feeling a little bit of all over the place still, because there's a lot of good ideas, but we want to keep the directive, but we don't want to lose the spirit. But then there's all these other nuances that are coming up, and I'm not sure exactly where we're going unless there's like a formal vote and then we just go for it.
Well, I think I agree with you, Jim. I think that part of that is I don't think that any of us know where the disease is going right now. I mean, it looks like one of these things that can whip back. I mean, we're getting into the most vulnerable time of the year, so that I think a lot of us are trying to be cautious and at the same time be as reasonable as we can possibly be without appearing to be dictatorial in an unrealistic way. I'm going to suggest, based on what you just said there, Jim, that are there any particular members of the boards that would like to participate in a little advisory committee with Jim so that they can actually put together some ideas so that at the next meeting, we can actually start to go forward with some kind of an idea that would be endure. If, in other words, anticipate recurrence of this disease, anticipate that it's not going away, and try to get a handle on where we are with if we can have some people volunteering to be on a little advisory committee there, put together some recommendations so that we can have a long-lasting approach to this disease that would be responsive to changes in the dynamics of the disease locally, and understanding that this will also anticipate more vaccinations, more variants, more disease rates, but to have some kind of flexibility to it. And at the same time, I do think it's a reasonable thing for Jim to clarify, for the purposes of the public understanding, what they might misinterpret, based on your phone calls you get and things like that. Some of the I would call it, you could call them regulations that you're putting onto the existing directive, but just some directions for people so that they know in this situation they don't have to do this, that this is intended for larger groups, and clarified for it without actually getting together and putting together a whole new directive. I think that you're probably able to do that, just responding to the kinds of questions and uncertainties that you have to field all the time.
But here's what I'm hearing from a couple of people from the public, and I don't think it was a groundswell. It's the directive. People aren't misinterpreting. We're not saying to cancel weddings. The problem is people don't want to mask indoors as the directive asks for, because if you can't social distance, it's asking for masking indoors. So I would have to change the entire event protocol, what Bob was mentioning, to make that accommodation, because what it comes down to is there's a handful of people that have weddings coming up and they don't want to wear a mask indoors that will ruin their photos. So I would have to.
I don't think Bob was saying that. Were you?
No, not Bob. What people are saying, in what I think where Bob and I were going is like, we have to expand the smaller scale events that may include vaccinations, COVID tests, and so on and so forth. But like what I'm hearing from that individual is like the sticking piece is the events where you still have to mask indoors.
All right. Well, let's just see if we have a vote here. Just anybody. Can we vote on? Do we want to significantly change the existing directive in any major way? Anybody who wants to do that, please say yes.
I don't want to change the spirit. I just want to make it an advisory.
So that's a yes. Okay, anybody else? Okay, Jim, can you handle some of the complaints that were made tonight and that you're aware of with just simple additional directions that you'll attach to the existing directive in a way that doesn't change the spirit of it at all?
Yeah, Zach and I can mess around with it, and we can fiddle with it. And if people have specific questions, they need help addressing a specific venue, we can have that conversation with that venue to help them out, to think about best ways they can safely do an event. We can do that.
Okay, well, I think we've figured it out that we're not ready to move significantly on this advisory at this point, and I think there's a lot of reason for it, and that we will clarify some of the things that were brought up. And I thank LM for her inputs there. Thank you very much. And what I'd like to do then is to go to The next discussion point here, which is, let's see, who is this? Is Jennifer gonna?
Jennifer Kimball.
Is Jennifer presenting next?
Yes.
Okay, so Jennifer, would you please present? Jim, you want to introduce her?
Yes, so Jennifer Kimball, who works for the Berkshire County Opioid Abuse Prevention Collaborative, which has been around for quite some time, doing a lot of fantastic work around the county with substance use and education outreach, policy work. I've known Jennifer for a long time. She does fantastic work. And actually, Tritone was one of the original co-sponsors of the Opioid Abuse Prevention Collaborative when that came out many, many years ago. And it was something that we looked into, and we didn't possess the expertise to really do an awesome job. And Jennifer and her team have done a lot of great work. And Jennifer has reached out. She had reached out to me about a month or so ago, wanting to come to the board to give an overview and talk about what she's looking for from the Tritone boards. Jen, I did make you a co-host. You can pull your presentation up and do your thing.
And just making sure that everyone can see. Can everyone see everything just fine?
Yes.
Okay. Hi, everybody. My name is Jennifer Kimball, and I'm a principal planner for public health. And yeah, Jim and I have known each other for a little bit. I coordinate the Berkshire Overdose Addiction Prevention Collaborative, which has been around since 2013, Jim. So it's been a while. We were originally established by a Bureau of Substance Addiction Services grant through the Massachusetts Department of Public Health to do primary and secondary prevention around opioid use disorder. That original grant has ended, but we are quite sustainable in doing multiple things related to substance misuse and diseases related to substance misuse. And we sit at a lot of different tables, from housing to equity. And tonight specifically, I wanted to talk about two grants that originate at the CDC that come through the Bureau of Substance Addiction Services, and what those entail and what it would mean for local Board of Health members to become more involved in these projects and how to understand their role in preventing overdoses, overdose deaths, and diseases related to overdose. And I also wanted to introduce two of my strong partners on this specific CDC grant, Sarah DeJesus from Berkshire Harm Reduction, and Stephen Murray, who is a harm reduction consultant and also is known as a lieutenant on the Northern Berkshire EMS. So if you guys want to wave, they'll also be co-presenting with me this evening. And I'll try to make this as snappy as possible because I know that it's been a long evening, but we're open to all questions at the end. So thanks for coming tonight, and thanks for having us here. And anytime in the future, if you wanted us to come back and talk about our broad scope of all the different programs that we do, we are happy to do that as well. So we at the Berkshire Overdose Addiction Prevention Collaborative have been awarded two grants under the CDC Overdose Data to Action. One of them is building on the work we've done countywide, all 32 communities, to build with community partners, and then eventually pilot and expand post-overdose engagement programs throughout Berkshire County. So the pilot is starting with Northern Berkshire EMS, and they serve multiple towns in Berkshire County, and also Berkshire Harm Reduction, who you may know as a Berkshire Health Systems program, formerly known as Healthy Steps, who does syringe access programs. So the CDC grants that we're talking about tonight are the first one is to develop and implement comprehensive post-overdose engagement programming in the Northern Berkshire region with the intention to roll it out statewide. We went through an intensive 18-month planning process facilitated by C4 Innovations with a bevy of regional partners, including EMS providers, harm reduction organizations, Northern Berkshire Community Coalition, Williams College folks, local law enforcement, the DA's office, public counsel, kind of working together to develop what this would look like as an EMS harm reduction partnership post-overdose engagement program. What we found is that when we engage, when law enforcement has a role in all of this work, however, we found that it can kind of create barriers when we're talking to people who use drugs, their willingness to talk and engage with law enforcement, also the fear of law enforcement or existing warrants. So this is a really innovative model where we will, within 24 to 72 hours of an overdose, follow up with the person who has overdosed, and also any bystanders or family members, and offer whatever supports are needed at that time. As you know, you just can't force someone into recovery. You can't actually force people to do much of anything. It doesn't usually turn out very well. So this is really a client-led process where we just meet the client where they're at. If they would like harm reduction services, that's great. If they want to go to detox, we can help them with that. If they just want to start a relationship, they want to know where they can get Narcan, they want to know where they can get food. All of these things are included in the post-overdose program. And we are also working with a HIPAA secure data management system, and I can always talk about that at a different time as well. But it's really a client-led process to meet them where they're at, reduce overdoses, reduce overdose deaths, and hopefully start making them have more human contacts, more connections that will result in better health outcomes for that person. So that's the first CDC overdose data to action grant. The second is, I'm not advancing, so give me a second. I'm going to do this instead. There we go. Overdose data to action 2, which is about expanding harm reduction services or expanding comprehensive drug user services, and what also known as syringe access. As you know, we have you may or may not know that we have 3 approved state-funded syringe access programs in Berkshire County. They are called Berkshire Harm Reduction. They were formerly Tapestry and Healthy Steps, but it's now a health systems program. One in North Adams, one in Pittsfield, and a recently approved one in the town of Great Barrington. And these are fixed site models, so they have a fixed site. As you know, many people in Berkshire County are transportation challenged and are, what do you call it? How would you say, our mass transit is a little challenged as well. And so it's hard for many of our clients to access these services and access more information about how they could get treated for hepatitis C or where they could get medications for opioid use disorder. So, or where they can get clean and sterile equipment if they are currently using drugs and have not decided to stop using drugs at this time. So this grant is to connect with the remaining 29 local boards of health in Berkshire County who have not signed what's called a local control letter, and I'll get into that later, allowing state-funded syringe access harm reduction in their municipality and encouraging them to do so and go through that process with the Bureau of Infectious Disease and Laboratory Science at the state. We're also working with other regional EMS and mobile syringe access units that are engaged with our post-overdose program to be able to ensure that we can leave comprehensive drug user health products at the site. So if we would want to be able post-overdose to leave Narcan on site, we want to be able post-overdose to have the EMS to have the capacity to leave sterile syringe access equipment on site with that client. If they've already used their Narcan, they might, they have overdose, they are at a very high risk of overdosing again. And so in many cases, they are not going to be able to get Narcan until the next day, or they might have to travel far to get it. This will ensure that we can leave these supplies on site. And so this is also something that can improve the health outcomes and reduce the spread of HIV and Hep C and other diseases related to drug use. So I wanted to introduce to you Sarah DeJesus from Berkshire Harm Reduction, and she will tell you a little bit about what comprehensive drug user health services are, the services they provide, and some data around some really good work they're doing around hepatitis C. So Sarah, take it away, and I can advance the slides whenever you tell me to.
Sure, thank you. So I think Jennifer actually did a really good overview of our services in the first part, but really our ultimate goal at Berkshire Harm Reduction and through any harm reduction program is to reduce negative consequences associated with drug use, not only for the person who's using drugs, but for their family, their friends, and the larger community as a whole. There's some really good programs for prevention of drug use that teach people about drugs and the reasons why we shouldn't use them. There's some really great recovery programs, sobriety programs, treatment programs, medication programs. But there's also a lot of people in between those two categories. And there are people that cycle in and out of drug use and recovery and abstinence and relapse. And so we work primarily with that middle population who is using substances and either not engaged in any type of treatment or maybe partially engaged in some type of treatment. And our goal really is just to keep people safe and keep people alive. The larger component of what we do is our syringe service program, which is typically what gets people in the door into our program. But once they're engaged in care with us, we have a number of support services, again, to keep people safe. One of the things that we do is overdose prevention education and naloxone distribution, or Narcan. So we teach Narcan groups. We talk to people about how to recognize an overdose, how to respond to an overdose, how to administer Narcan. And we do that not only in our office, but in collaboration with other community organizations and for the public as needed. We also provide testing for HIV, Hep C, and other sexually transmitted infections. People are not going to stop using drugs if they don't have access to new syringes. They'll reuse syringes, they'll borrow and share with other friends who are using, and that puts people at increased risk, like Jennifer said, for HIV, Hep C, and other injection-related infections. And Hep C specifically in Berkshire County is, the rates are higher than the state average. And so I'm going to talk a little bit at the end about a Hep C treatment program that we started about 1.5 years ago, specifically for people who are using drugs or have had a difficult time accessing Hep C treatment for a number of reasons. We provide basic wound care. So someone who has an abscess or an injection-related infection and either doesn't have a primary care provider, isn't comfortable going to urgent care or the emergency room for whatever reason, we're able to help them with that in our office. And then we also do provide referrals for other community services and support. So if somebody comes in and wants to go to detox, wants us to help them find a bed, whether locally or throughout the state, needs housing advocacy, needs insurance, needs resources for access to food, anything, we kind of become a safety net for people and connecting people to other resources in the community. A big part of what we do is education for our participants and just constant reminders about being safe and taking care of yourself and not putting yourself at risk for overdose and for infections. It's really just a great program. It's when you show people how to take care of themselves, they start to realize that they're worth taking care of, and it has a domino effect on the decisions, the positive decisions that people make. So a little bit about our Hep C treatment program. It's very easy to access. Historically, people have had trouble getting into treatment for Hep C for a number of reasons. So we eliminated as many of those barriers as we possibly could. So in the last 1.5 years or so, we've tested just under, probably just about 400 people at this point. For Hep C, 138 of those were positive for Hep C and eligible for treatment. 80 people, which is probably again a little bit higher at this point, have started some phase of the treatment process. There's a couple steps to it, but again, we do it all right in the office and make it very easy for people. And we've had 32 people clear their Hep C, which is incredible because the overall program has been in existence, the harm reduction program, since 2017. And so between 2017 and June of 2020, we had 0 people clear their Hep C virus. So 32 people in a year and a half is a huge accomplishment, and those numbers continue to grow. And the last thing that I just wanted to highlight, I think Jennifer mentioned a lot of it really, but the transportation issue is a struggle for a lot of people throughout Berkshire County. So we're very lucky that we're going to be able to get a mobile unit, an RV, where we'll be able to provide all of the services that we provide at our brick and mortar locations in a mobile fashion. So we'll be able to essentially bring our services to where they're most needed and eliminate that transportation barrier for people. We constantly try to think about how we can have our services more accessible for people. Another way is to expand the hours of operation. So we're soon going to be open later in the evening, probably until 8 p.m., which will be helpful for a lot of people. And then Jennifer mentioned some of the additional locations that we continue to reach out and know that people can benefit from these services, and just bringing us to where they are.
Thanks, Sarah. And now I'd like to introduce Lieutenant Stephen Murray from Northern Berkshire EMS, but also Never Use Alone. And he's going to talk about the practicality of our harm reduction EMS partnership and how that further reduces barriers and moving away from traditional models and some of what they are going to be able to do through these programs. So Stephen, take it away.
Hi, good evening, everyone. It's nice to be in the Tri-Town. I started my EMS career actually as a Lennox firefighter. My family lives in Stockbridge, so I have a lot of history with this community, and it's nice to be having this conversation with you guys. I'm also myself an overdose survivor and person in long-term recovery for more than 10 years from opioid use disorder. So this is a very personal issue for me. And it's really important that we as a community get together. The Tri-Town area has seen 12 fatal overdoses from 2015 to 2020. So this is a reality in this community for sure. So where we come into play with the EMS side of things is that we are starting to leave behind Narcan at the scene of overdoses. We've been rolling this program out in Northern Berkshire County, but we're working with our partners. And actually we were able to go into Lee and had a very great interaction with the Lee Fire Department who runs the ambulance. And they are also now leaving behind Narcan as part of this program. We're also leaving lots of information about services that are available and helping to connect people with different programs. Our hope is to expand this to mobile syringe exchange. So mobile syringe leave behind. It's kind of a process, as you know, to get through the state. This is something that's not being done anywhere in the state yet. And I hope that Northern Berkshire EMS will be the first pilot site for syringe leave behind. And the reason why this is important is that when you think about brick and mortar sites like Berkshire Harm Reduction, they're open sort of normal business hours. And as someone who's been working weekends for my entire EMS career, I'm currently the Saturday supervisor up in North County. I am fully aware that nights and weekends are very difficult times to access these services, and it's often when they're most needed. And so our hope is that as 24-hour services, which EMS is, we can help in these moments when people are not able to access brick and mortar to expand their ability to get harm reduction supplies and Narcan. I think you can go to the next slide. I think that's my next slide. yeah, so this is basically what we're working at. And I think that's all I have. So thanks so much for having me.
And so where a local board of health comes along, you may know this or you may not, Mass General laws. So in order for a syringe services program that is publicly funded, a publicly funded program to operate within a municipality, the local board of health must grant approval. That's for a fixed site, that's for a mobile site, that's for if you were going to leave, be part of your EMS leave behind. The local board of health has control over this. And so that's, you'll see there, Mass General Law, Chapter 111, Section 215. So we could have a mobile van with Sarah, but right now they couldn't provide all of the services to Lee Lennox Stockbridge because there's no local control letter there signed there indicating that these services, publicly funded services, can occur. It should be noted that any privately funded agency could do this at any time in any town in Massachusetts, and that syringes are also decriminalized, just as a note. So I wanted to discuss just briefly what the local control process would look like. You would need, a local board of health would need to put this item on its agenda for a publicly held meeting. You have to bring it to a vote. And I always say, use the very exact language as cited in the local control template letter that I can share with you via email for your town. And then you would take a vote. If it passes, you'd send a copy of the letter with the certified minutes from the town showing that a vote was taken in support of syringe services programs, and you send that to the Bureau of Infectious Disease and Laboratory Sciences. And then it usually takes less than 90 days for the Massachusetts Department of Public Health to let you know that they have everything. This is an example of a local control letter. We have used this in multiple towns in Berkshire County as an example. Obviously in North Adams, Pittsfield, and Great Barrington, but also most recently, it might be interesting, you might be interested in knowing that the towns of Egremont, Sheffield, Peru, and Washington have all taken votes in support of syringe services programs being available to the people of their town. So it's basically, I'm pleased to inform you that the Board of Health, whatever submitting authority, took a vote on the date to allow a qualified and appropriate organization to operate. You can put mobile syringe services program, you can put syringe services program in the town of X. Attached, you will find the minutes. We look forward to hearing from you. Thank you. And that's kind of the local control process. And really it is that simple. We are encouraging local boards of health to bring this to their agenda and to take a vote in support of these services. I will add that it would be, I want to remind people that a private entity can do this at any time. This is only for a publicly funded entity. And it would be highly unlikely for another fixed site. Just so if a town wanted a fixed site, I think that would be highly unlikely for Berkshire County. I think we have 3 and that's what we're going to get. So I think it's important to show support for these life-saving services. And that is really the extent of our presentation. So I will open it up for any questions from anywhere. And I'll also look in the chat to see if I see there's some red things there, but I don't know if that's for me or not. Oh.
I don't think there's anything in the chat, Jen. I think someone had to leave to take care of
Yeah,
the
that was Steven. He has a very new baby and it needs attention. So we will let him do that.
Anything from the board? I mean, the only thing I have couple questions. There's definitely a Hep C issue in Berkshire County. We see it. We see it in the Tri-Town towns through our Maven system. That's always been an issue in Berkshire County. Regarding the mobile unit, have other towns worked with their fire, EMS, and police just to make sure they kind of know what it is? Because one of the things, if we see a van someday parked on Main Street, it's one of those things we just want to communicate with, fire, police and others, just to know like what the program is and so on and so forth. And we continuously have a substance use issue in Berkshire County. It's just a matter of how addressing that is. And I will agree that transportation is a major issue in Berkshire County for people to access programs. That's definitely a problem.
I can respond to that, and I think Sarah can too, because this came up at Washington. It's, we talk about, in small towns, everybody knows everybody else's business. And if a van is showing up and this and that and the other, and we work very closely with towns, but also very closely with clients who live in these towns, as to what best fits for them. Certainly when we worked with siting in North Adams and what, it takes time and nuance. Those are fixed sites. So that was a little bit different, but we do, through this process, we've had discussions with each town about what would it look like for us. And it's really we look at what the client load is, we know we have clients from almost every community, in Berkshire County and also outside of Berkshire County and the hill towns in Hampshire, etc. The town of Washington's like, hey, behind our town offices is really private. People are coming and going all the time. You'd be welcome to park here, but that's the town of Washington. That's their business. And also the police and fire were all there at the meeting too. So, so it's really something that we would talk about the town. We wouldn't just all of a sudden show up beep, beep one day and here we are. This is a part of a community, really about a community discussion, and there's certainly more appropriate places than others to have vans. So that's just part of, and Sarah's well versed in citing issues and other kinds of things like this too. Is there anything you wanted to add to that?
I don't think so. I mean, really, we just try to be as transparent as possible. Our goal is not and would never be to come and just, like Jennifer said, show up one day in a van and catch people by surprise. We talk to organizations, we talk to first responders, and we, really just want the program to work for each individual community, whatever that looks like.
I'm glad that you mentioned about the Lee EMS fire, that they're on board with the Narcan. I know that depending on who you speak to and what perspective, that continues to be a controversy for some reason. I'm a believer that all fire EMS should be carrying Narcan and possibly police, but that's me. That's my perspective. We should always be prepared. I'm glad Lee's carrying.
Yeah, and I do want to add, just as another grant, a side note around Narcan, we also have a grant right now where we can outfit all Berkshire County first responders, regardless of if they're volunteer or paid positions, with Narcan. And since that push has recently come out, we've had many first responders in multiple towns take us up on that. So I'm hoping that through that push, we can outfit a whole bunch of folks. And also you might be, know that Rep Smitty Pignatelli is advancing about requiring all first responders to carry. So I think we're rounding the bend on that, but it's been quite a fight. But I think each town really needs to work with us in partnership, and we need to work with y'all to just figure out what looks good for you. And it might not be that we ever visit your town, but the one thing that I would say, it's not about just the van. I don't want to discount the van, but this is also about a pilot that would allow a first responder to leave these things behind on site. That would include Narcan and syringes in a kit. And so that is very private. That is very discreet. No one would need to know what's going on in that family. So maybe that's the one thing that your town is going to really want and need more than a mobile van. It's really up to, we look at the client load, we look at what's practical. So we're pretty flexible. It's just the way that Massachusetts does its health laws, as you know, Jim, with 351 unique local boards of health. We have to visit every single one of you, and we wouldn't want things to be peppered throughout the county and be very confusing and not cohesive. We would like everybody to be able to take advantage of these services if they're needed.
Dr. Kenny, do you want to entertain any questions or comments related to this? You're on mute. Still on mute.
Jim, I have a question.
Sure.
With regard to the logistics of this, say everyone or most were in favor of it. This sounds like a town by town event. Is that, in terms of creating the approval for this? It goes by each town, is that right?
Yes, but the Tritone district is a formal district, and
Okay.
if the district can make a motion, and I would be clear in my letter to DPH who we're representing.
Okay. I mean, I was envisioning a situation where, barring any real drawbacks to this, which I don't think are there, that it would have some force if we could come up with a unanimous approval on the tri-town basis, and then have the strength of that go to each individual town, board of selectmen, et cetera, for consideration or approval or whatever. However, I have to admit some ignorance with regard to the municipal steps. I know they were outlined earlier by Jennifer, but I would see some power in that, to go with the town boards, the powers that be, the posting with the declaration that the tri-town board members were unanimously in favor, et cetera. That kind of thing would be great. Now, I can't obviously vote for everybody, but that would be my suggestion anyway, something along that. Let's look hard at it. Maybe we all need to do a little due diligence or get off and have some conversations. But I would look forward to some sort of oomph behind this and bring it with that spirit of unanimity, or, whatever the right word is there, as a show of strength in favor of this kind of thing.
So we would essentially entertain a motion to vote and approve this, so there's the paperwork that goes to the state showing a binding vote with the documents that go with that. In addition, we could craft a cover letter explaining what we voted on and asking them to support and endorse the program. Because I don't think it would be a selectman's vote, because they wouldn't.
Oh, okay.
I didn't know by the general laws, the select boards don't really have jurisdictional authority related to the law that Jennifer requires that boards of health.
Okay.
But it would be a correspondence saying, hey, we voted on this, and I would work with Jennifer on helping me craft that kind of summary and saying, we're asking you to support this. I mean, one of the things I was a little bit confused about, because I thought, Jennifer, maybe the sign off, the vote was really related to the mobile thing. But what you're saying is we still need to vote for the leave behind kit too. No?
No,
Okay.
no. What I was saying was that, it may end up that you never have a mobile van visit your town, but or you don't think it's going to be needed in your town, whatever. But yeah. I would assure you that this would be something that your EMS might be interested in leaving behind. And I think the way we've done it in towns that don't have a board of health, it's whatever the regulatory authority is in that town. So if it's the select board who acts as both, it's the select board in that town. So
we're independent boards of health and for Tri-Town.
So it would have to, I think, go to each town vote, but I think a unanimous vote by the Tri-Town Board of Health would show a lot of really good intention.
Well, and I would address that, Jennifer, because Tritone is a formal board that represents all three towns. We
Okay.
can, if the board wants the motion and vote on that, I'll make sure they understand what that vote means.
Great.
Bob, do you want to make a motion with respect to what you suggested?
I'd like to hear what you think.
Well, I think it's a good idea. I'm not sure that that I understand the logistics of getting this implemented. Is it the case that the individual boards have to vote separately on this and send separate letters? Or is it the case that Tri-Town alone can do it? I don't know that. Jim, do you know?
We're a formal health district. We're actually the only ones in Berkshire County that are formally a legal district. We have a quorum of the three boards here. And if the Tri-Town boards make a motion, whatever language Jennifer needs, I will send that letter to Kevin Cranston and explain to him what the vote is. If they rebut, I don't think we need to go back to an individual board meeting, but I think what Bob's suggestion is that we send some type of update to each select board and maybe even CC EMS, police, and fire what the program is, and that we'll be working with stakeholders, in the future. And I would work with Jennifer on that correspondence. I can make that happen. But to answer the question, point of order, the Tri-Town can vote as all three boards.
Jennifer just sent me or sent around something saying she thinks each town has to vote.
But I don't understand, I think maybe what Tri-Town's powers are, I guess.
So
in this case.
So to just put this to bed, when general laws are passed, they don't take in consideration formalized districts. It's so they say each town, because each town has autonomy. The Tri-Town boards is a formalized, recognized district that the state recognizes that represents all three towns. So if the board is okay with a motion, I'll handle that. And if Kevin Cranston comes back and says something to me, I'll deal with that and we'll deal with it.
I see Jennifer just posted in the chat column the language, and I would be, I would love to make that motion if it was allowed in the appropriate language for a vote by the Tri-Town membership. For the a motion with the appropriate language to make this happen.
I'll second.
All in favor?
Aye.
Okay, so this is the motion to put this forward. Any discussion about this? I'm sorry, I asked for the vote before I had any discussion. Does anybody want to discuss this any further? Okay, so does everybody understand that Dr. Westbizer has put forward a motion that we should incorporate, that we should approve a letter to the appropriate authority using the language that she's given us here and substituting the important specifics to support her project? Yeah, all in favor of that motion? Pardon me, all in favor of doing that?
Aye.
Aye.
Anybody against? Okay, thank you, Jennifer, for your proposal. Jim, will you take care of that then?
I will take care of it.
Very good. Thank you for the
Jim.
presentation.
Thank you for having us, and reach out at any time. I'll put my email in the chat too.
Hey, Jennifer, maybe we should connect on maybe a memo to the select boards to help me kind of quantify what exactly you just presented. I'm still trying to.
Yeah, we can do that. No problem.
I'm still digesting the directive in my mind.
Yep.
Okay, I think we've covered the agenda. Does anybody have a motion to adjourn?
I'll make that motion. Make a motion to adjourn.
Anybody second it?
I'll second it.
Second.
All right, thank you all for this. I assume it's a unanimous.
Good evening.